Hello, Healthy Beginnings cohort. This is Jessica Steiger from the MCHIP team, joining you today to share just a brief overview of Title V funding. This overview is going to be helpful to you in preparing for our December full cohort call. So I'm going to do a brief overview, and then there are going to be two other presentations for you to view and a mural for you to contribute to as part of the pre-work for December's call. So without further ado, I'm going to talk a little bit about, like I said, the Title V block grant and sort of how funding works, some of the national requirements and like structures for Title V funding. My objective is really just to give you an overview of these national requirements for Title V funding allocation. So I'm not going to get into the nitty-gritty, just kind of a national overview. Excuse me. So I want to make sure we're all on the same page about what Title V is. So Title V refers to Title V of the Social Security Act, and specifically it's dedicated to assuring that there's access to quality services for mothers and children. And there's a special focus that we don't talk about much on our Women's and Infant Health team, but that's very important. There's a special focus in Title V on children and youth with special health care needs. And we sometimes we call this acronym SHIN occasionally. So if you hear SHIN, that's what we're talking about, this kind of group of children and youth with special health care needs. So Title V is a block grant. And what that means is that it's largely flexible funding. And it's a formula grant. And so it's awarded to 59 states and jurisdictions, provided that they submit an application and a plan that addresses the needs for health services for mothers, infants, children, and children and youth with special health care needs within their state or jurisdiction. So in order to receive those funds from the federal government, they really have to do these three things. They have to submit an application. The application has very specific structure and requirements, an annual report on how they spent the previous year's money. Similarly, there are kind of structures and requirements from the federal government. And then once every 5 years, the state has to submit a comprehensive needs assessment. And that needs assessment is really to assess the needs of the entire maternal and child health population within their state or jurisdiction. So they do that once every 5 years, but a lot of states will sort of continuously assess the needs from year to year. So I want to talk a little bit about how funds are allotted, what the requirements are at the national level. So block grant funds, like I said, they're meant to be flexible, which means that states, for the most part, can use them however they need to in order to meet the unique needs of their maternal and child health population. And the amount of federal funding that each state or jurisdiction receives is based on the number of children in poverty within that state in relation to the number of children in poverty nationally. So that's how the federal government determines how much money to give to each state or jurisdiction. The state can use Title V funds to provide health services and to plan, administer, educate, and evaluate things that are related to maternal and child health within their state or jurisdiction. Funds cannot be used for cash payments to intended recipients of health services, and it can't be used to purchase land, buildings, or major medical equipment. And then there's this other element of the Title V funding that we like to call the 30-30-10 requirement, or the 30-30-10 rule. So this is basically a requirement from the federal government, from the legislation, that says that at least 30% of federal maternal and child health block grant funds have to be used for preventative and primary care services for children. At least 30% of federal maternal and child health block grant funds have to be used for services for children or youth with special health care needs specifically. And then no more than 10% of those federal funds can be used for administrative costs. So like for the costs of administering the Title V program. So that 30-30-10 requirement is important because it means that about 60% of funds are really dedicated to children in some way. And really specifically that 30% go to children and youth with special health care needs. So wanted to talk just briefly about how what the guidelines are for how Title V programs could use their funding. So states have to provide funding for services that fulfill each of these like 10 MCH essential services that are listed here on this slide. And the federal government encourages Title V programs to structure their funding so that most of the funding, so that it kind of falls in this pyramid, so that most of their funding is going to public health services and systems, and the least amount of funding is going to direct services. And we'll talk more about what those are. So I want to kind of give a breakdown of each of these levels of the pyramid, these three levels. So at the foundation there, public health services and systems, those really include like services or elements of the system that reach all mothers and children in the state or jurisdiction and really make up the infrastructure of the MCH ecosystem. So for example, that includes things like newborn screening that everybody has access to. If there's work in a policy development space, a policy would impact the entire maternal and child health population. So that would be under the category of public health services and systems. Child immunizations, things like that sort of fall into training, like some form of training that impacts the whole system. Those sorts of items sort of fall into this infrastructure foundational area, and the federal government really encourages Title V programs to direct the majority of their funding into this sort of infrastructure space. The second level there are enabling services, and enabling services are services that support folks' ability to access direct services. And so those are things like transportation to your doctor's office, or health education, translation services, case management. Most of the work of community-based organizations in this cohort, so doing things like providing doula services, community health worker services, health education, supporting coordination of services, most of those sorts of things and most of the work that that community-based organizations in this cohort do would fall under the category of enabling services. And then there's this top of the pyramid is direct services, and the direct services are defined not necessarily as like a service that is direct from one person to the next, and that's why doula services are not actually a direct service. Direct services are actually basic health services and health services for children and youth with special health care needs. So in this space, Title V is really meant to be gap filling. So the majority of Title V funding really isn't meant to go to healthcare services unless there's a gap in the state's medical system. Nobody else is covering these services, in which case Title V can kind of step in to fill the gap. So some examples of what they mean when they say basic health services, they mean things like prenatal or primary medical care, visits to a doctor, pharmacy costs, laboratory costs, hospital costs, dental services. So very specific healthcare services, which is why, like I said, doula services don't really fall under that category. It's not a healthcare service, or providing like facilitation of support groups would not be a direct health service. That would fall under enabling services. So that's why most of what the community-based organizations in this cohort do really falls under enabling services. And then some of it could certainly fall under public health services and systems. There are community-based organizations in this cohort that support policy development, that help with quality improvement, that weigh in on needs assessment development. Those things would fall under public health services and systems. And then the last thing I want to touch on is the state matching. So the state, in order to receive those federal funds from the government, they have to match every $4 that the federal government provides them with at least $3 of non-federal funds. And states have more flexibility in what they can use those non-federal funds for, because things like the 30-30-10 rule, they don't apply to the non-federal funds. Those only apply to the federal funds. So some states do actually match above that minimum $3 for every $4 federal funds, and you're able to see how much your state matches, what they spent their money on, how it was broken down between direct, enabling, and those public health systems levels of the pyramid. You can see all of that in your state's Title V block grant, which is publicly accessible to you. So from here, we're going to ask everybody to visit a mural document after you watch the other two video presentations. We're going to ask you to ponder some of these questions that are up on the slide here. And we'll also be sure to send out links to access the state's applications and annual reports. So if you haven't looked at your state's Title V application or annual report, you can do that. And you can peruse how they spent their money, how they came to decisions about how to spend their money. And we're going to talk more about that during our December call. So if you have any questions, please don't hesitate to reach out. You can email us at wih@amchip.org. You can also email me directly at my email, jsteiger@amchip.org. And we're excited to see you in the December call.